Good morning, everyone. Welcome to our class on nutrition for your heart and specifically on blood pressure. It is February 2025, and for Heart Month, we are going to talk a little bit about some of the things that you can be doing in your daily lives to improve your long-term heart health. My name is Megan Ellison. I'm a registered dietitian nutritionist. I'm also a certified diabetes care and education specialist. And I have a private practice in Snohomish County where we are, coming to you live from today. And our class today is sponsored by Stilly Valley Health Connections, which is hospital district number 3 here in Snohomish County. And Stilly Valley has a lot of resources, which we're actually going to talk about at the end today, some of the resources that you can get plugged into if you're thinking about making some changes for your health. And they have just general community resources beyond like nutrition and health as well. So we're going to talk about cardiovascular disease, CVD, just briefly, and why does it matter? The first few slides will be just a little technical, and then we'll move into like nitty gritty of what you can be doing. We'll talk about blood pressure guidelines. Hopefully you're checking your blood pressure occasionally. Dive into some interventions, so specific things you can be doing for managing blood pressure, how those changes may be adding up as far as how much you can expect on average to reduce your blood pressure. That's kind of motivating to see those numbers. Taking a long-term perspective, because this really is about long-term health, and then providing you some resources at the end. And just so you are aware, I cannot see you or hear you because we are in webinar mode and the chat is disabled. But if you would like to make a comment or if you would like to ask a question, please do use the Q&A and I will check that occasionally throughout the next hour. Okay. So what is cardiovascular disease or CVD? It's actually a group of different disorders, but they all affect the heart and the blood vessels. So you've probably heard of things like coronary heart disease, which is really about the blood vessels around the heart, cerebrovascular, which is really referring more to the brain, peripheral artery disease, which is about the periphery, so your arms and legs. And then we have some less common forms of CVD, like rheumatic heart disease from damage to the heart and the heart valves from fever that is caused by a bacteria. And then even, congenital heart diseases. So, birth defects, the modern medicine, that we're in today is pretty amazing that we don't really see these things in the United States as far as like rheumatic heart disease. We really don't see that much because we have antibiotics, but it is still a major concern in the developing world. And with our congenital heart disease issues, we have surgeries and we have tiny pacemakers for babies and all kinds of amazing things these days. So, we have ways to manage those things. And then lastly, deep vein thrombosis and pulmonary embolism, which is basically blood clots in different parts of the body. So that's kind of like the overview of, what we mean when we say cardiovascular disease. And it matters because it is the #1 killer. It's the leading cause of death globally. So these are stats from the World Health Organization. Almost 18 million people died of cardiovascular disease in 2019, basically over a third or about a third of all deaths. And 85% of those were due to heart attack and stroke. So we're really thinking about, preventing those endpoints of those major acute issues. We know that cardiovascular disease can be prevented, especially by behavioral strategies, environmental risk factors like reducing smoking and tobacco use, working on diet, which we're going to talk about today, weight management, more physical activity, and reducing things like alcohol, and even things like air pollution. We do know that all of those toxins, the things we're breathing in, are affecting our endothelial function. And which is basically like, that little thin line of the internal vessels, the blood vessels that get impacted by all these things that we are putting into our body, either breathing and eating or drinking, and that adds up over time. So it's important to really be thinking about this from a long-term perspective, because heart disease doesn't happen overnight. It really is like a progressive thing that we can be making changes right now and affect the outcomes of in our future. So we're going to talk about those things in a minute. But here are the current American Heart Association blood pressure guidelines. So if you've had your annual checkup recently, they would have done a blood pressure. Really, almost anytime you go in and see a doctor, they'll check your blood pressure. And one of the reasons for this is because we call it the silent killer, because a lot of times people don't know when their blood pressure is high. We don't feel any different. We don't notice any symptoms. So it kind of sneaks up on us. So it's nice to actually get some objective data and get it checked. So you can see the normal is under 120 over 80. This is millimeters of mercury is how we measure that. Elevated 120 to 129 with a diastolic less than 80. So that systolic is when like the heart is pumping. It's like the squeezing, and the diastolic is when the heart is relaxing. Stage 1 hypertension would be 130 to 139 with a diastolic of 80 to 89. And this is an either or scenario. And then stage 2 with a systolic of 140 or a diastolic of 90. And then we have things, that are even more elevated than that. And hypertensive crisis is really considered 180 over 120. And it's an and or scenario. So if you ever see that on your blood pressure at home, or if you check it at like the local pharmacy, for example, I would be very concerned about that and double check it. Like, take a couple minutes, do your deep breathing, double check it. And if it's still elevated, you really should be seeking help right away. So you should be calling your doctor. You should, potentially be going to the ER and, not letting that go. Okay. So usually we see hypertension not just by itself. Like usually it is, more than 50% of people with hypertension, they have something else going on. So it's in a little bit of a cluster. For example, diabetes or lipid disorders like high cholesterol or high triglycerides, overweight and obesity, hyperuricemia, which is just basically saying high uric acid in the blood, metabolic syndrome, which is like another little cluster of syndrome, things like, for example, low HDL, high triglycerides, a high waist circumference, elevated fasting glucose, and high blood pressure. And then just general unhealthy lifestyle habits, smoking, high alcohol intake, sedentary lifestyle, which, a lot of us have that sedentary lifestyle thing going on these days with how much we sit. So we'll talk about that a little bit. And the reason that we're, concerned not just about blood pressure, but those other things is that the presence of one or more additional cardiovascular risk factors proportionally increases the risk of coronary, so heart, cerebrovascular, so brain, and renal diseases, so kidneys, in people with hypertension. So we're thinking not just blood pressure, but all those other things. The interventions that we're going to talk about today, though, really address all of them. So, when we talk about like a high fiber diet, it addresses things like diabetes and high cholesterol, as well as hypertension. Okay, so the recommendations for lifestyle changes to lower blood pressure, these are just some major ones. There's things on here that we're not going to touch on, but the big ones are weight management, physical activity, following a DASH dietary pattern, limiting sodium intake, limiting alcohol intake, and we'll get into each one of these. But let me just check the Q&A. It looks like nothing is in there yet. Okay, I may have some questions for you, though, in a little bit. Okay, so weight management is very complex. Like metabolism is very complex. And we know now it's not just calories in, calories out. It's much more complex than that, including things like hormone control. For example, sleep is right at the top of my little diagram here. If you have an underlying sleep condition like sleep apnea, that changes your hormones, including things like appetite hormones and stress hormones. So it really can change, how you're responding, like your body is responding to food and how you are changing your choices of food intake and even the amount of food intake. So there's a lot that goes into weight management. And we do know that the successful people who lose weight and keep it off long term are addressing three major aspects. So they're looking at the dietary intake, they're also looking at physical activity and making changes there, and then behavioral changes and like addressing mental health side of the equation. Because if there's something getting in the way, like attention deficit or depression or something going on where it's really making it hard to make the changes long term, that needs to be addressed so that you can move on and then make those little goals and adjustments to your diet and lifestyle. Okay. And we do see in the research that the best outcomes are seen for people who are engaged in frequent check-ins. And that's from the obesity task force guidelines of 2013 and also the United States Preventive Task Force guidelines in weight management indicate somewhere between 20 to 26, like a lot of visits a year. That's like one every couple weeks, right? And that could be with a professional, like a dietitian. It could be with a personal trainer. It could be with, your walking group. It could be like a group setting. But we do see that people who are engaged, with another person in some form towards their goals are more likely to reach their goals. And we can expect reduced blood pressure from some weight management, especially a little bit of weight loss if you have some weight to lose. And it's basically about a millimeter of mercury per kilogram. A kilogram is about 2.2 pounds. So, or there's 2.2, pounds per kilogram. So, if you're thinking about it, it's about like half a millimeter of mercury per pound. Let me just look at the chat really quick. Let's see. There are questions. Yeah, what is Hg? That's the symbol for mercury. Millimeters of mercury. Okay, I will send you this handout. I have a little handout on weight management. This weight management, I call it the wheel. And on the backside, some little snippets on each one of these things and how we can potentially, intervene to help with supporting a healthy metabolism. For example, fiber, dietary patterns, like how are you spacing intake over the day? Of course, portions, things like sitting and screen time. How can we break that up? Mentioned the sleep, stress management is actually a big piece of the puzzle. We're not going to talk specifically about stress management today, but it also is directly impacting blood pressure. Some of the things that we're going to talk about, like exercise, is a good stress management strategy anyway. But if you have a very stressful life, like that is probably a key factor for you to hone in on to be getting some support and some strategies to reduce that stress or at least manage it. Okay. So our physical activity guidelines for Americans have been the same for a long time. And the number one thing is avoid inactivity because we're sitting so much these days that it, really does make a difference when we just get up. Even the recommended like 3 minutes per 30 minutes. So if you're sitting for 30 minutes, like we're going to be sitting here for the next hour. Ideally, we do at least 6 minutes. So 3 minutes per 30, 6 minutes of some sort of activity after sitting for this hour. Even just that little bit, if you can, intersperse that throughout your day, that does help lower your stress hormones. It helps lower your blood pressure, helps lower your blood sugar. So a lot of my patients with diabetes, we specifically put in tiny amounts of movement to keep their blood sugar control down, over the day, especially after eating. But that's the number one thing, try and activate your life. Try and make the things you're already doing a little bit more active. And then the recommended minutes for moderate intensive aerobic activity is about 150 minutes a week. Or if you're doing more vigorous activity, like where you really are having a hard time like talking, like your heart rate is so elevated and you're putting in so much intensity that you can't really hold a conversation. That would be intense. Then we see that, you really have more bang for your buck in those scenarios. So we see pretty much the same benefits with about half the time. But for most people, we're going to be focused on that moderate intensity exercise or activity. And that equates to about 20 minutes a day. So you can break this up however you want. 20 minutes a day, 7 days a week. It could look like 30 minutes a day for 5 days a week. You could do some, longer sessions, like maybe you have 3 50-minute classes, like a Zumba class and a, yoga class and a spin class or something like that. But you want it to be aerobic, meaning you're getting your heart rate up, it's repetitive, like swimming, for example. My little icon there, swimming, rowing, elliptical, dance is so fantastic for that. But something where you're getting your heart rate going. And then the other recommendation is for resistance exercises. So basically like strength training at least twice weekly. 3 times is better than 2 if you can fit in 3. But we know that even 1 time a week, we see improvements, especially in older adults, for maintaining muscle and bone density. So whatever you can do to fit in that, strength or resistance exercise is really going to give you dividends into the future, partly because it is impacting your metabolism. So when you keep that muscle mass up, your metabolism is working better. And then that impacts everything else. That impacts like blood sugar control, blood pressure control. Long term, it impacts things like, your ability to do activities of daily living and your balance and fall risk and all of that. So we really want to keep your muscles strong. And anytime you're working on your muscles, you are automatically working on your bones. So, when we are resisting or we're putting some strain on our body, the body sends more nutrients to that muscle in that area. That muscle is pulling on ligaments, the ligaments are pulling on the bone. So it's sending all these nutrients to reinforce and strengthen that area. So it really is like, both bone and muscle that you're impacting, which is, kind of a nice return on your investment. Don't forget about stretching. So there are 3 modes of exercise: aerobic, strength, and stretching. And actually there's new research out showing that stretching can even impact, like increase muscle. Because again, you're putting some strain on your muscle when you do your stretching. So even that can be, beneficial long term. And of course, it's helping keep your mobility and your flexibility. Okay, so for following the guidelines, you can expect about an average of 4 to 9 millimeters of mercury reduction. And we're talking about systolic blood pressure here. Okay, so that's kind of the activity side of things. I will just make a note that the thing that I see mostly in my population that gets people hung up on this, on the activity side, is an all or nothing mindset. So sometimes we feel like we've got to go do an hour for it to count, or we do nothing. And the reality is like every little thing adds up. So you want to be figuring out, how do you actually like flex that muscle of getting on the treadmill, or flex the muscle of getting out the door with your shoes. And it's more about consistency over time than trying to like, do an hour and really, almost hurt yourself because you're kind of trying to overdo it in a short period of time. We really want this to be like enjoyable. We want it to be included throughout your life. Ideally, you'll be doing things that you love to do so that you will keep doing them, possibly with people that you enjoy, so that that's also a motivator. For some people, it helps to like literally put it in the calendar and, put it as an appointment. Um, so whatever works for you, but, think about small, like how do you start out? If you're not doing anything right now, think about smaller wins. How do you do 2 minutes instead of the 20 minutes? And then you can gradually increase from there. Okay, let me just check the Q&A really quick. Question is, how close to 150 minutes do you need to be? I do 3 40-minute water aerobics classes a week. That's amazing. So the 3 40 minutes a week is fantastic. I love that. So you're basically up to 120 minutes at that point. I would think about, can you do something else on one of the other days? So like instead of 3 days, maybe you add a fourth day of something at home. This person is using a walker. So for example, I would recommend something like the Sit and Be Fit. I don't know if you guys know about this on TV at 9 a.m. Or just, I'm using a lot of times YouTube. So with a smart TV or even like a little smartphone, like a cell phone, you can YouTube, whatever you want to do. Chair yoga, Pilates. I'm doing a lot of dance these days, Zumba, there's all these free things. So whatever your fitness level is, you can find something to meet your needs. Yoga, you can put in like yoga 10 minutes for shoulders and you'll get some results with that. So you can be very specific. So, I would just say like find one other thing that you enjoy doing and try and set that as a new goal because you're already really close to that 150 minutes. Okay, another person says, oh, this is the same person. You have a pedal thing that goes under the desk. Yeah, Rebecca, that would be great. Just, do some of that pedaling throughout your day, get your heart rate up, hopefully, with it. That's a great strategy. I love it. And then Cynthia says AARP has a wide variety of Zoom classes too. That is really good to know because I did not know that. I'm going to make a note of that. Thank you for that. So check out AARP, I'm assuming online. That's great. Okay, let's talk about dietary interventions. So you probably have heard about the DASH diet before, dietary approaches to stop hypertension. It's one of our most well-researched diets, like dietary patterns that we have. And specifically, it was created for lowering blood pressure. It's a high fiber, like a plant forward approach. So it's not solely plants, it's not vegetarian or vegan, it's just mostly plants. And because of that, you're getting a lot of the things that help to lower blood pressure, such as potassium-rich foods like fruits and vegetables. There's an emphasis on whole grains versus refined grains, so you're getting more B vitamins, more fiber there, more of the heart-healthy fats and fat-soluble vitamins like vitamin E. Calcium and magnesium-rich foods, both of those help manage blood pressure. So dairy, nuts, and seeds. There's an emphasis on lean proteins. So, we're going for less of the saturated fat and more of the like plant-based proteins, for example, like beans and lentils, or fish and seafood that has the heart-healthy fats like omega-3s in there, or poultry, just to remove the skin so you're not getting as much of that saturated fat, and then leaner cuts of red meats in small portions. The emphasis, though, is really on those unsaturated oils. And you can tell an oil is unsaturated because it's liquid at room temperature. So if you're, scanning what you have in the pantry and you see something solid, that's a saturated fat. So that's the type that's going to like raise cholesterol, for example. Okay, with following a DASH pattern, average reduction in blood pressure for the systolic blood pressure is 8 to 14 millimeters of mercury. So that's a really good bang for your buck. Here's a visual of what a DASH pattern kind of looks like. So the bottom pyramid here is fruits and vegetables, and then whole grains, mostly whole. some refined, but we're really trying to get away from those ultra processed foods. Low fat dairy and seafood, poultry, and lean meats, and then some beans, nuts, and seeds, heart healthy oils. Sweets are at the tippy top because we know that sugar, a lot of us are getting way too much added or like refined sugar. So be careful with the sweets because we know that's a negative, thinking about cardiovascular health. So this was originally designed by the National Heart, Lung, and Blood Institute. And like I said, it's one of the most well-researched diets at this point. And it is a little bit lower in fat and higher in dairy products than Mediterranean, which we're going to look at in just a second. But overall, it's low in sodium, it's low in sugars, and it's low in saturated fats. Let me see. I'm going to clear some of these things from the live. There's a question, can we please receive a recording from this webinar? Yes, you will get a recording from Stilly Valley Health Connections and also my slides and also some handouts that I'm going to send that will hopefully be helpful. So let's look at Mediterranean. So the Mediterranean pattern is just slightly different where with this pyramid, they're really like, having activity at the bottom. Now, these people are not doing what people in the region of the Mediterranean are doing for their lifestyle, like their activity. Their activity is built in to their days. They're walking places, they're walking to the market, they're walking to their friend's house, they're walking to work. They are sometimes like working the land. A lot of them have little mini gardens at their homes. So it's not like exercise like we have here. It's just an active lifestyle. So if you can build in an active lifestyle for yourself, that's one of the easiest ways because then it's just part of your environment. It's just part of your daily routine. And then you'll notice that the whole grains and the fruits and veggies are kind of swapped here. So more emphasis on whole grains and starches like potatoes, pasta, breads. But of course, these are mostly like made from whole wheat, for example, and they're oftentimes fermented. There's not a lot of extra processing and preservatives that go into it. And there's not the added salt and sugar that we add to our breads here in the United States. So it really is a different thing. But yeah, the starches and grains are a pivotal, foundational part of a Mediterranean intake. High consumption of colorful plants, so your fruits, your nuts and seeds, your vegetables. Of course, the predominant oil is olive oil. Dairy is usually incorporated daily, oftentimes in the form of like homemade yogurt or cheeses like feta cheese or goat cheeses. And then for proteins, this is, less common or less frequent and less in portion size compared to our typical intake. So that'd be like fish and seafood, poultry, eggs. And then at the tippy top here, sweets and red meats. So the animal portions are, included, but smaller amounts compared to the standard American diet. And sweets and red meats are really only occasional. Fluid intake is mostly water. Small amounts of wine are incorporated in many of the Mediterranean cultures. It just kind of depends on what is the predominant religion of that area. But yeah, that is a pretty typical thing in a lot of the Mediterranean cultures. And the reason we're talking about Mediterranean is because it really is the side by side with DASH. It's the other dietary pattern where we have a lot of research specifically on heart health, but also things like blood sugar control and weight management. So depending on, what kind of resonates with you, you can look at both of these patterns and think about, what are you missing? What are you missing in your diet? What do you need more of? What are you maybe having a little bit too much of that you could, back off to make room for the things, particularly like the fruits and the vegetables? How can you make a few little swaps? Maybe the whole grains instead of the refined grains, or like, olive oil instead of butter, like all those little swaps can make a difference over time. And one of the reasons that both of these are so successful in, improving heart health is the amount of plants. And we do know that now, now that we have more research on this and we're learning about the microbiome all the time, like our beneficial bacteria in our gut, we know that the plants which have fiber, fiber is only found in plants. So the fiber is helpful for cardiovascular disease. It both can lower blood pressure and cholesterol, but it's not just the fiber, it's actually the colors in the plants. So we're understanding this more and more that the colors are not just associated with like micronutrients, like your vitamins and minerals, but it's the phytonutrients in there that can actually feed our microbiome, like feed our healthy bacteria that then help us to manage weight and glucose and cholesterol and blood pressure. And a lot of those phytonutrients are naturally like antioxidant and anti-inflammatory. So they're also helping like prevent that long-term damage to the vessels, the blood vessels. Um, and the reason, why we're thinking about, antioxidants and anti-inflammation and specifically blood pressure is all that like little damage, the oxidation, the high blood pressure can cause microscopic damage in our blood vessels. And then those little tears, that little harm to the blood vessel is when we start getting deposits of cholesterol because the body is trying to like, patch the hole. So then we get these, laying down of cholesterol, we start getting some little streaks of plaque. That's where we start, building up this narrowing and hardening of the arteries over time. And so we want more of these colors, more of these antioxidants to really deal with some of that damage. And then anti-inflammatory components to come in and also just reduce the cascade of inflammation that happens from that damage. So the more that you can eat the rainbow, the better off you're going to be. Plus, it's a lot of fun. You can kind of treat it like a game, try and get more color in your week. Think about what colors you're missing. So maybe you're eating a lot of like salad, like greens, but not the purples and reds and blues. So, look at your different colors. This little picture came directly from the American Heart Association website, and they've got some great little tips on their website. All right, let's look. What is the fifth color group? I see 4. Yeah, white. So white like onions. So you want to be getting, cauliflower, onions, and other alliums like garlic, leeks. We know are super heart healthy. This is from plants, but we do know that even like brown, like from our whole grains, and like things like dark brown flaxseed have phytonutrients that some of our bacteria really love. And so, think about that color as well, and even black, like chia seed and black olives and black beans. So the full complement of all the colors. So that could be a good little goal for you. Work on the color intake. Okay, let's talk about sodium specifically, because we know that most people in the entire globe, like most populations, are consuming way too much sodium. This is data from the World Health Organization. And our average intake is over 4,000 milligrams a day. The recommended intake is about 2,000 or less. So we're basically getting double what we really need. And we do know that there are, significant number of deaths associated directly with sodium. So it's not just a matter of like blood pressure, but we know that it affects other things, like it directly affects our kidneys, for example. So, the WHO is indicating that reducing sodium is one of the most cost-effective measures to improve health. And basically for every dollar of invested, US dollar invested in scaling up sodium reduction interventions, that the ROI or the return on investment of that is at least $12. So sodium reduction interventions, for example, The USDA and the FDA are working on having manufacturers over time reduce sodium just naturally, but gradually within some of the products, like some of our canned goods, some of our packaged goods. That is a goal. They're doing it slowly so that people don't freak out because, their green beans taste differently or their, heaven forbid their Doritos, are not as salty. But the goal over time is to reduce the sodium in our processed and packaged foods, but that's going to take some time. You can be way faster than that, and we're going to look at some ways to do that. But it does equate to health dollars. There's a huge health um, and burden risk, like an actual cost to consuming too much salt. So what can you do? We've already talked about, Mediterranean dash patterns. Both of those are great because it's mostly fresh, minimally processed foods. You can remove the salt shaker from the table. The salt shaker only adds about 10 to 15% on average. So that's not like the bulk of where we're getting our sodium, but it is that extra little amount. So if you want to do that, maybe replace it with some spices, which we'll talk about in a minute. You can cook with little or no added salt. So for example, a lot of recipes out there indicate to start with salting your pasta water or salt your vegetables while you are sauteing them. You can skip that beginning salt and just do finishing salt. Like just do the salt on the top that you're actually going to taste instead of it getting into the food where you're really not going to taste it as well. You can use herbs and spices to flavor food, and then naturally you'll need less salt. There are some salt substitutes out there, and particularly the ones that contain potassium. And those are interesting because they taste salty. So, like potassium chloride tastes salty on our taste buds, just like sodium chloride does. But it doesn't have the salt. And actually, potassium does the opposite in our body. It helps lower blood pressure. So that can be a nice option for people, just to replace, the type of salt that they have. And there was a recent study that just came out this week, actually, looking at salt. It's called the Salt Substitute and Stroke Study. And they were looking at replacing sodium chloride with potassium chloride and noting a significant reduction in secondary stroke or secondary cardiovascular outcomes. So, like after someone had already had a stroke or a heart attack, if they replaced their salt with potassium-based salt, the reductions were like, I want to look at my notes, 14% reduction in stroke and 12% reduction in overall death. So, that's an easy swap. Now, the caveat with this is you don't want to just do it without talking to your doctor, because if you've already had a stroke or you've already had a cardiovascular event, you may be on medications that are salt sparing, meaning that they cause you, or sorry, potassium sparing, meaning that they cause your potassium to go a little higher in your body anyway. So you want to just double check that you're not on any of those medications with your doctor, because we don't want to just be giving you extra potassium from like a concentrated form or like a supplement form unless you can handle that. So for most people, it's going to be great, but for those on medications, just double check. Okay. The place that we find a lot of our sodium intake, about 70% is coming from packaged and prepared items, meaning it's already in the food or it's in the food that you're eating out or at a restaurant. So that's the majority of our sodium intake, at least in the United States. So if you're eating more at home, if you're making things at home, you are going to be controlling your salt better. And you can even make little swaps in the packaged items. So for example, your canned goods, nowadays you can find no salt added or reduced sodium or low sodium, which is a regulated term, meaning it has to be 140 milligrams or less per serving. So all of those things, those terms are regulated. So if you're just like, let's say you're just starting on this journey and you're like, I want to change my taste buds. You can do that. You can do it gradually where you go from the regular to the reduced, from the reduced to the low, from the low to the no. Or if you want to just rip the Band-Aid off, just go with the no salt, right? And then you can always salt to taste at the end. Like that's an option. And then it's on the top of your food instead of in your food. So you're actually going to taste it. Okay. What about spices? So we know that you can add a lot of flavor without the salt, but also your spices and herbs are going to be adding micronutrients. So your vitamins and minerals without the calories. So they're very nutrient dense. And those phytonutrients that we already talked about that feed your microbiome and have the antioxidants. So whatever you can do to, add more of these spices and herbs to your cooking is a really good deal. And then naturally you'll be able to decrease the salt because you're going to have a lot of flavor there. So a lot of people have in their cupboards, me included, have really like, old spices or things that I haven't used in a while. Sometimes it's nice just to get it out, get it out in the open where you can see it, put it on the counter so you don't forget about it. Even see what you have there. You might have some things that you really enjoy and want to be using more of. For the herbs, they can be a little expensive in the grocery store. So you can make your own little herb garden, like on a windowsill or in pots on a balcony, or if you have a little space in your yard. It's nice to have like chives and rosemary and oregano. They'll just kind of go crazy here in the Northwest. So you can just get them planted and then they're perennial here. They will come back every year. But whatever you can be doing to, increase that spice and herb in your life would be great. I will send you a little handout on that as well. Okay, let me check the chat or the Q&A really quick. Okay, it looks like we're good on questions. So let's talk a little bit about alcohol. You probably have heard in the the social media lately and the news lately, there's been a lot of talk about alcohol and how, no amount is healthy. Prior to that, we did have some guidelines on a little bit might be helpful for reducing blood pressure, but really the recommendation is to not start imbibing if you don't already. And remember that alcohol is very calorie dense. So it's almost as calorie dense as fat. Like, like if you think about your wine glass filled with olive oil, that's almost how much calories you're getting there. It's 7 grams or 7 calories per gram. So, it's very calorie dense without the nutrients. So it's kind of a little bit of a waste. Now, I will say, some people find it very relaxing. Some people do find it impacts their blood pressure in a positive way in small amounts. But we do know that it does increase the absolute risk for certain types of cancer. So, the recommendation is don't just add it if you're not already having it. If you do enjoy a glass of wine or a cocktail or a pint of beer every once in a while, have it with some food to help reduce that risk, particularly in your like esophagus and stomach. So what is considered a serving? A serving is a 12-ounce pint of beer, a 5-ounce glass of wine, or 1.5 ounces of distilled spirits. And I will say, like, I have wine glasses here that will fit an entire 12-ounce can of sparkling water easily. So think about, check your serving. Think about your pour. How much are you actually having? A lot of times it's way more than we think we're having. So just double check that. And then keep a limit on it. So the recommendation is limiting to 1 drink for women and up to 2 drinks for men. That's per day. And slight reduction in systolic blood pressure with keeping it to those limits. Okay, so here are how some of those changes can add up. So if you're thinking about like, a little bit of weight loss and you follow a DASH pattern and then you add some physical activity and you're watching your sodium and you're limiting the alcohol, you really could be seeing, if you're doing all of those and you start like layering them in over time, you really could be seeing reductions that rival medication management. So like, 30 points reduction in your systolic blood pressure. That that really adds up. So, pick one of these. Think about, where you want to start. Identify for you what it is that you think you really need to work on or want to work on. And just start, kind of chipping away at it. We'll talk about behaviors in a minute. But look at how that can add up. It can really make a big difference over time. And again, we are thinking like big picture with this because cardiovascular disease is a long game. Alrighty. When you're thinking about behavior change, there's a lot of strategies. I put a few little books here if you're interested. These are some good ones. Habit Stacking, Atomic Habits. You can get that on audiobook as well. And then this equation here comes from Tiny Habits by BJ Fogg. And basically like an equation for behavior. And it goes behavior equals motivation, ability, and a prompt. So do you have motivation? Like, do you want to do the desired behavior or do you want the desired outcome, right? Like, is the outcome motivating enough that you'll actually do the behavior? Can you do the behavior? Like, is it realistic for you? And then something to remind you to do the behavior because we're so busy. When you're going about your life to actually make a change and like stop what you are normally doing and like interject something new, that can be really difficult. So you want some sort of prompt there to remind you. It could be a smart watch, it could be an alarm on a phone, but it could just be anchoring it to something else you're already doing. So for example, after I blank, I will blank. So after I start the coffee, I will do my counter push-ups while the coffee's brewing in the morning. And then I will immediately celebrate by doing a little dance and having my cup of coffee that I enjoy. So, he really emphasizes putting in a little celebration, like patting yourself on the back, having a mini win, having that positive reinforcement to then, play into the next thing that you're going to do, the next success. So hopefully that'll be helpful for some of you. I also highly recommend this Atomic Habits book. You can listen to it on like Audible and some really good tips in that one. But do take a long-term, big picture perspective on this, because again, it takes a long time to accumulate when we're talking about cardiovascular issues. And your behavior changes, they add up over time towards health. So the number one thing that I see with my patient population when they don't get to their goals is they're trying to do too much, it's unrealistic, or like setting too big of a goal or something that's not really attainable, or they're trying to do too many things at once, like they're trying to make too many changes all at one time. So you really want to like think small and sustainable, but then also think about like what do you want to focus on now? And then that will lead to the next step of your success so that you're heading in the right direction. So I would take a moment to write down a couple things for yourself. 1 to 2 realistic goals. Actually write them down because we know that helps solidify it for us. Tell someone because that actually makes it even more real and that you're going to follow through on it. And then actually have a deadline for yourself. So say like in the next week or within the next month, I'm going to, increase my steps per day to 4,000 steps or whatever your goal is. But be realistic with it because we want this to be sustainable and we want you headed in the right direction and not just discouraged and throwing in the towel. Okay, so speaking of not getting discouraged, we have several resources for you. I put a couple of my favorite cookbooks on here just for fun. This Reducing High Blood Pressure cookbook is by a good friend of mine, Kim Larson. She's a dietitian here in the Pacific Northwest, and really good recipes, really good overview of managing blood pressure in that book. And I use a lot of those recipes on a regular basis. And then the Prevention magazine group put out this Mediterranean table cookbook, which is also by a couple, I think it's a dietitian and somebody else helped edit. Um, and there's really good recipes in there that are a little bit more exotic. So if you want to kind of expand your cooking, expand your palate, expand your spices use, that's a good one for that. And I just did a Mediterranean cooking class recently with Stilly Valley. You can see that recording on their website, and used recipes from this Mediterranean table cookbook. Okay, heart.org is a great resource for you. It's free. That is the American Heart Association website. And you can go click on the healthy living link, and then it'll give you links to other topics like sleep and smoking cessation and activity. So whatever, kind of resonates with you, you can get more information and more resources on. I would say your own physician is a huge resource for you. If you haven't had your annual checkup or if you don't have a primary care physician at this point, please do get that person, because remember, a lot of times with blood pressure, we're not feeling the changes, we're not feeling any different. So you want to get those annual checkups and just be on top of your like preventive health. Be preventive about this. Check out your local gym. A lot of times, my seniors, people who are 65 and over or on Medicare, have silver sneakers programs that they can tap into locally. And then once you're in a local gym, you could have that resource of seeing a personal trainer. Oftentimes when you join a gym, they give you like one free lesson with a personal trainer. So that's kind of nice to kind of orient you to the facility, come up with some goals for yourself, and also be doing, the exercises correctly so that you're not having injuries. So that's a good resource for you. Do think about your mental health resources, counselors, psychologists, and psychiatrists. And are you talking about your health goals with them? Are you talking about these healthy behaviors that you're trying to, make changes in? And bring that up so that you can have that support, or talking about what's getting in the way of making those healthy changes. Consider meeting with a registered dietitian, nutritionist. Many of you will have insurance coverage for this. Insurance coverage is pretty good these days for nutrition counseling with a registered dietitian. So you can check that by calling or by looking on the website. And that would be for more like very specific, meeting specific medical goals, like if you want to lower blood pressure or cholesterol or blood sugar or weight management, or if you've got kidney issues, we can get pretty nitty gritty. Through Stilly Valley, we have some resources for you. Monthly this year, in the year of 2025, we have a Take Charge of Your Health monthly class. It's a 1-hour class on the first Monday of every month. And we are going through a book that is called Preventing Diabetes, but it's really like geared towards preventing chronic conditions in general. So you're welcome to tap into that class at any point and join us. So the next one is coming up here in March, not that far away. And then quarterly, Stilly Valley is also sponsoring an Ask a Dietitian class. And it's basically a time where we can meet together for about 30 minutes. I get to see you actually, which is really fun. And you can ask random nutrition questions, like whatever you want to ask nutrition wise, like whatever's on your mind. I am happy to try and answer those questions for you. We had a great first class, a lot of really good questions from, I think, about 8 or so people. So check out the website, stillivalleyhealth.org, for our next class on that. It's only a half an hour, so join us. It's a lot of fun. And then if you don't have any resources through your insurance, Stilly Valley, if you are in their hospital district, if you're a district resident, they are also sponsoring something called health coaching. And it is with a registered dietitian from my practice. So it'd either be me or another RDN. with sound dietitians. And basically, it's working on your goals. It's getting together either virtually or in person to talk about your health goals and how we can support you in accountability and ideas and strategies. So that is really geared for people who don't have any nutrition counseling benefit through their insurance, because we don't want people falling through the gaps and just not having any support. So they've been very generous in coming alongside and providing that resource. Okie dokie. So thank you to Stilly Valley, and happy Heart Month to everybody. I hope you're thinking about your heart health. I hope that you are on the track towards wellness. And let me just look at the Q&A one last time. If there's any last questions, feel free to put them in the Q&A. And again, my name is Megan Ellison. I'm with Sound Dietitians, and thank you to Stilly Valley for sponsoring today's class. Hopefully I'll see you at a future class. All right, everybody, take care.